we need to understand that our body is not functioning 100%. So that's where Ayurveda can really help you, to prevent something getting established later. So if there is anything in this world that can contribute to almost every disease in the world, that's stress. You can go for a walk, then attend a meeting. You can do that together, but you can't attend two meetings at the same time, or some people try to do that, and that's something really triggers the adrenal glands in our body to make the stress hormones.
Right.
And that's the beginning of the process of the stress. And most of the time, the clients who are coming to Ayurveda, they have tried other modalities before and they haven't received any relief from that. So, compared to that, this is not at all bad. One thing is listen to your body. Eat when you're feeling hungry. Rest when you're feeling tired. So, take a moment every day to listen to your body and ask yourself how you're feeling today. And if you're not really feeling good, ask yourself where it's coming from.
Good day, everyone. My name is Navneet Anand from aajKal, local and global. As we have already started a series with the health professional visiting our studio, and today we have got Dr. Rafeena with us. Dr. Welcome to the show.
Thank you, Navneet. Thank you for having me.
Tell me about your childhood and the educational background back home.
Sure, Navneet. So I'm from Kerala, as you might know. So I have completed my childhood education there. So after year 12, the norm in Kerala, quite possibly throughout in India, is if you are studying for +2, like year 12, if you are studying science, you will get into the medical entrance examination. You go through that series, and Ayurveda is one of the degrees that you can pursue after the entrance. So that's how I got into Ayurveda. Quite possibly, when I was in year 10, my mom had an accident and she had a fracture on her elbow, and it didn't go through really well with the conventional approach. So rather than going for surgery, mom insisted to go for an Ayurvedic physician.
Oh, so that was the turning point of
I
you being
think so.
inclined towards Ayurveda.
I think so. I think so. Quite possibly that must have been the experience that made my mind to decide that, after the medical entrance rank, like, okay, this is what I want to do. So I decided then and there. So from a very young age, I started studying Ayurveda and completed my bachelor's in Ayurvedic medicine from University of Kannur in Kerala. And that's how I began my journey in Ayurveda.
That's a journey of your education back in India. When did you come to Australia?
I came in Australia for the first time in 2009. I just followed my partner. It was his plan. Okay, we have lived in India for some time. Let's explore the world. So then we decided that, okay, we will try Australia first. That's how we came here. But having said that, I was working for Kerala state government there, like the primary healthcare centers in Ayurveda there as a medical officer. So there was a bit of formality, like, I need to complete before taking leave and going somewhere. So I went back, completed my probation there, then took leave and came back to Australia in 2012.
Ayurveda is one of the fields that I have seen that the health professionals are too keen and too passionate about the profession that they are in. And you chose Ayurveda over the conventional medicine. What could be the reason?
I'm not sure whether I can exactly say I chose Ayurveda over the conventional medicine, because in that medical entrance examination, I didn't get really qualified for the conventional medicine. So that's when I decided, okay, I will go to Ayurveda. But still, still to some extent that's true, because the usual practice is for the first time, if you didn't get for the MBBS, then you will try again. But I didn't go for that.
Right. So you had the chance to go and retry it and get
Again.
into MBBS with the rank that you had, but you
Yeah.
chose to be in Ayurveda.
Yeah.
Right.
And I did some further studies as well. Like I have completed postgraduate diploma in yoga then, and also I have completed certificate in gynecology and obstetrics. So that's how. And also you have mentioned just now that Ayurvedic practitioners, they are quite passionate about Ayurveda. One reason could be because from the time that you study Ayurveda, you practice Ayurveda as well. and you practice Ayurveda not just with yourself, your family, your extended family, your friends, and everyone, and you can really see how much it can help, you know.
Not only the bachelor's in Ayurveda, you said you have done masters in yoga as
Yes.
well.
Yeah.
So the combination of the two is a lethal combination in terms of when we say the recovery, the cure
Yes.
of any of the individual. How do you think Ayurveda and yoga are better in terms of curing the long term disease
Mhm.
or the recovery mode?
Okay, yeah, sure. So I think the first thing that we can begin with is the prevention of diseases.
Right.
There is a phase that we know that, specifically when we are in a, we decided what to do in our career, and we get busy with that, and that's when we kind of lose the focus on our self-care. Then over the period of time we realize that the quality of health is not that good anymore. My energy is not great, or maybe I'm feeling anxious lately, or my sleep is not great, or I'm feeling gassy in the stomach. So then we may go to a GP or specialist, we may explore some diagnosis, and everything comes back saying that it's all fine. So that's the time, that's the first point that.
But the anxiety is there, the reflux is there, the
Yeah.
acid is building up, energy is going down.
Mm.
A GP says everything is fine, but there's something wrong
Yes,
somewhere.
yes. So that's the first time we need to realize that even though nothing can be assessed with the present testing system, we need to understand that our body is not functioning 100%. So that's where Ayurveda can really help you, to prevent something getting established later. So that's when we need to understand, okay, now how can I support myself? So the prevention, it can be started much earlier before we suffer anything. Like there are so many learnings from Ayurveda that we can follow, like dinacharya, known as our daily routine. So in other way, what should be our morning routine and what should be our evening routine, how to eat on a daily basis so that we can maintain our health and we can prevent anything that may happen in terms of our health, in terms of seasonal health problems as well, like hay fever, what can be done to prevent that. So that's the first step. Then Ayurveda also discusses regarding seasonal routines. So in terms of different seasons, how to support ourselves. For example, during summer, what should be the changes that we need to make in terms of diet and lifestyle? And then during winter, what are the other changes that we need to consider now? And specifically around the season junction, like how to transit from one season to the other season. So there are so many learnings from Ayurveda like this that we can apply on daily life to prevent from diseases. So that's the first phase. Then the second phase is the scenario that I have mentioned earlier, where we are struggling in terms of the quality of our life or health, but still nothing can be diagnosed as such. Then comes the early stage of the diseases, where again Ayurveda can do a lot. Like we can see that some inflammatory markers are high, or blood cells are a little bit off, or liver enzymes are a little bit high, or there is like fatty liver. There is something coming up, but there is no exact treatment available with the conventional medicine again. So that's where again that Ayurveda can really help you. Like, we can address the problems happening with the body then, and also we can prevent the establishment of further diseases as well.
What I could understand is normally we go to our GP, a doctor, or a specialist when we are sick. But what you are saying is, rather than getting sick, it is better to prevent that we don't fall sick.
Definitely, 100%.
So, change of food habits, season wise as well, is one of the key area to be looked at. Probably we'll be doing another episode and food choices in the different seasons that we can think of. You talked about anxiety. You talked about stress. During the professional life, when we are trying to follow the dreams, we try to achieve the goal that we have set it for ourselves, and sometimes we change that goal post further. We get lost in that.
Yeah.
So Ayurveda and yoga can help to reduce stress as well as to get us a better lifestyle.
Definitely.
How true is it?
Yeah, definitely. So if there is anything in this world that can contribute to almost every disease in the world, that's stress. And I usually say that everyone in Sydney is stressed. Okay.
Mhm.
That's how I feel like. So, what we can do in terms of avoiding stress. First of all, the first thing that we need to do, so I can give you a couple of, takeaways on that matter. So, first thing is multitasking. So generally multitasking is considered is, something that's really great. So for someone who is
It's
quite highly
considered as a skill.
yeah, so that's considered as a skill. But to be honest, what we are doing when we are multitasking is we are fragmenting our focus, which is a huge stress for the system. So we can be fast, we can be quick, but we can't be rushing and we can't be multitasking all the time. There are certain things that can go together. For example, you can go for a walk, then attend a meeting. You can do that together, but you can't attend two meetings at the same time, or you can't really analyze one thing and attend another meeting at the same time. That's almost impossible. Some people try to do that, and that's something really triggers the adrenal glands in our body to make the stress hormones,
Right.
and that's the beginning of the process of the stress. So, in other words, the takeaway is to try not to trigger stress hormones in the system by not making the body to rush. So, whatever you can do in that aspect, do. So, a few things are avoid multitasking, practice of mindfulness. Then comes, the more detailed approach like, breathing exercises, meditation, things like that. So, that's something. Then if you are specifically stressed, then that becomes even more important, doing meditation daily, or it could be something simple as guided meditation, or you can begin with breathing exercise, something like that.
You talked about breathing exercise, you talked about meditation, you talked about not getting into a situation where one individual gets stressed. If we come to you, do you have any of these options available in your studio clinic where we say meditation, deep breathing, yoga, detox, any of the options available in this?
Totally. We have all those things mentioned available in our clinic. So generally, good thing about the consultation in Sydney, generally, that's the approach most of us are following. So the approach is the initial consultation. That's an hour-long process.
Mhm.
And sometimes, with someone with complex history, it can take even longer.
Mhm.
So we really assess where the problems are coming from. What are the habits, like in terms of diet, in terms of lifestyle practices, what are the triggers that leading to those problems. Then we recommend a self-care plan including diet changes, lifestyle changes, including the breathing exercises that they can consider, how long they need to do the meditation, things like that. So we recommend like that. And then also the Ayurvedic medications, the detox processes that can be done, the Panchkarma, the popular one.
Panchkarma.
Yes.
Mhm. Mhm.
Yeah.
I think Panchkarma. I'm gonna do a absolute full episode on Panchkarma and detox as well
Yeah,
in the coming days for our audiences.
definitely.
Right, but I'm trying to understand what all services you provide and what can one avail the services here in Australia
Yeah.
of the ancient history that we have with Ayurveda is brought to Australia. And what is the name of the organization that you work with?
It's Live Ayurveda.
Live Ayurveda.
Yeah, Live Ayurveda based in Parramatta. So, yeah, just to answer the earlier questions as well, again, there are yoga sessions as well, meditation sessions. So, you can also have one to one private sessions where the session can be completely customized as per your specific health needs. And then there are group sessions as well available.
So all these group sessions, are we doing it only in the Parramatta clinic that you have, or you always go and organize it outside in different suburbs as well?
It's good question. Like, it was a whole lot different story before COVID and after COVID.
Right.
Things changed,
Mhm.
and now it's a new normal, and everyone is going back to offices. So I can really see the changes happening with people's dynamics now. So earlier we used to do a lot of workshops and things like that, going to places. During COVID, everything became online. Now we are slowly getting back to offline again. So we are doing something here and there, but most of the things are either online or on site, but maybe last year happened couple of the events, something like that. This year happened couple of events, so we are getting the pre-COVID situation.
Normally, people have got something in their head that with Ayurveda, it's going to take longer to heal or to cure any disease that we have. How true is it?
That's a good question. So, if you ask me, my answer would be no, that's not true. Main reason is most of the time when you're coming to Ayurveda, we are trying to heal you. And healing needs time itself, We are not going with any quick fixes. We are not going with any band-aid solutions. Okay. So, we are trying to heal the body from deep. And that needs time. And if we are talking about symptoms, recovering from the symptoms, so definitely, as Ayurveda doesn't really use nerve blocks to block the pain or something like that, you may not feel the relief from the pain within next 4 hours or 6 hours. But from my observation, I have seen many people feeling some difference between 3 to 5 days. And looking at the complexity of the symptoms, I would say that that's not bad. And most of the time, the clients who are coming to Ayurveda, they have tried other modalities before and they haven't received any relief from that. So compared to that, this is not at all bad.
We were talking about the Sydney siders. The stress is there.
Yeah.
But especially with the migrant community who come to this place, leaving the home countries, have to work an extra mile to put the foot forward. And then in that exercise of putting a foot forward, sometimes we go and definitely invite stress even unknowingly.
Definitely.
When you see the professionals coming to you with the stress, anxiety, lack of energy, other than this lack of energy, anxiety, and stress, what do you see the people come with the symptoms and they want you to heal the process?
Yeah, sure. So one of the most common group that I find is digestive or gut disorders.
Mm-hmm.
Second group is allergy and skin. Like it could be hay fever, it could be eczema, those kind of problems. It could be respiratory problems. So that's second group. Then aches and pains. So like back problems, disc problems, sciatica, frozen shoulder, cervical spondylosis, all these different kind of aches and pains. And sometimes it could be something like, fibromyalgia or chronic fatigue syndrome where the pain is there, but we don't know the exact reason where it's coming from. So then again, rheumatoid arthritis, that's the third category that I see. Then the fourth category, I would say menstrual disorders, menopause, fertility related problems, the sexual health in general. And that's, so I will order them in that. I will categorize the diseases in that order, to be honest.
Look, I think having this first conversation is giving me an insight of the future, that the number of episodes that we can go and talk. We talk about digestive system, we talk about gut blockage, we talk about aches and pains, and there are endless topics that can be talked and discussed upon. Before I wrap up, to conclude, if you say someone has to integrate Ayurveda in their day-to-day life as a professional, what would be the tips?
Yes. One thing is listen to your body. Eat when you're feeling hungry. Rest when you're feeling tired. So that's the basic thing that you have to do. Then, as I have mentioned earlier, try to avoid the triggers. So take a moment every day to listen to your body and ask yourself how you're feeling today. And if you're not really feeling good, ask yourself where it's coming from. So that's the first step to solve that problem.
Thank you so much. With due respect to the whole medical professionals here in the country and Ayurveda including in that, I want to say thank you so much to all of you doing such a wonderful job to making the humanity and the lives better than ever before. Thank you so much.
Thank you, Navneet.
Thank you.
Thank you.
This is Navneet Anand signing off for aajKal, local and global. Thank you once again.
Thank you.
Fiji Times. Be with the times. One-stop answer to your Australian education and visa matters. Gemco Sydney. Dream big, achieve big.